Hi, my name is Torri Kitts, and I will be presenting on a unique approach to treating chronic low back pain. Here is a brief overview of the key points I'll be covering in today's presentation. So I began this mentorship during my clinical rotation at an outpatient orthopedic clinic. My motivation behind choosing a topic to research for this mentorship program was to directly connect with the patient demographic we were serving. Given that a significant portion of our patients came in with a diagnosis of low back pain, I found it intriguing to engage in discussions with dentists and dive into innovative approaches to address this prevalent issue. Rather than adhering to same conventional methods for every patient, we aim to comprehend the benefits of a personalized approach and its potential to significantly enhance the well-being of not only our patients, but future patients as well. If I were to ask you what the leading cause of disability is worldwide, what would your response be? If you mentioned low back pain, you'd be absolutely correct. In fact, it is such a widespread issue that I decided to conduct a poll on my Instagram account asking followers whether they personally encountered low back pain. Surprisingly, 97% of the participants responded with yes. With 97% being such a significant portion, I proceeded to inquire about their approaches to address or alleviate their low back pain. Here are some of the responses I received. Back extensor strengthening, piriformis, bridges, hip twist, icy hot is my life, chiropractor, strength training, tacos, rub some dirt on it. The list goes on to weed, focused on a lot of hip mobility and flexibility, increased strength, McKinsey method, pills, deal with it, hope for the best. So as you can see here, low back pain is a prevalent issue that many individuals experience at some point in their lives. While conventional methods like strengthening, stretching, chiropractic care, hip flexor exercises, and lumbar back braces are often recommended, it's intriguing to observe the variety of responses people have when discussing this common topic. So from humorous responses like rub some dirt on it to more serious suggestions like pills or weed, it's clear that low back pain elicits a wide range of reactions. However, in today's discussion, I will be discussing a more unconventional approach that received little to no attention in this context. So I'd like to begin by introducing a new approach grounded in 3 fundamental principles. The first principle revolves around the idea of move well and move often. As movement experts, we can agree that movement is the foundation of vitality and overall health. This principle goes beyond mere regular movement. It extends to moving intentionally and gracefully, respecting the intricate synergy between our bodies and minds. The second principle emphasizes protect, correct, and develop. We recognize the importance of prioritizing our patients' well-being. We want to educate and protect our patients' physical and mental health, address imbalances as they arise, and actively push our patient to growth, embracing opportunities for improvement at every juncture. Lastly, it's important to understand the significance of establishing systems that uphold these principles consistently. So as a physical therapist, we must value the role of consistency and aim to create a robust system to safeguard our commitment to our patients. So by embracing tools like the SFMA, the Aura Ring, valve technology, and the expansion compression model, we can obtain these principles. So through the optimization of movement and the implementation of comprehensive systems like the SFMA, which stands for the Selective Functional Movement Assessment, we can gain a holistic perspective on the patient's condition rather than focusing solely on isolated areas. Additionally, by applying the expansion compression model, we can improve breathing patterns and promote stretching and core strengthening exercises tailored to specific areas. This approach enables us to address the root issue and promote overall well-being in a more effective manner. So as technology continues to advance, we aim to harness its potential within our treatment approaches. So in an ideal scenario, without financial constraints or budget limitations, integrating technology to address low back pain is highly, highly desirable. So this opens the opportunity for us to research into and incorporate the latest breakthroughs in healthcare technology. By encompassing innovations like wearable devices, telehealth, 3D motion analysis, biofeedback tools, data analytics, and personalized treatment regimens. With these valuable tools at our disposal, we can provide highly precise and customized interventions tailored to individuals grappling with low back pain. So for instance, wearable devices such as the Oura Ring can continuously monitor and provide real-time feedback on essential metrics like sleep patterns. Sleep patterns are very important to monitor, as there are studies linking sleep patterns with an increase in low back pain if those patterns are disrupted. The Oura Ring also monitors heart rate, movement, and this empowers the patient to make necessary adjustments in their daily routine. Telehealth facilitates remote consultations with PTs, guaranteeing that patients, regardless of their geographical location, can access expert guidance. So ultimately, harnessing the power of technology equips us as physical therapists to deliver the most advanced and effective care, significantly enhancing the quality of life for those dealing with this widespread condition. So diving deeper into the 3D motion analysis, we can explore applications of VAL technology. So on the right of the screen, you'll notice a force deck in action, which measures the force applied during a sit-to-stand movement. It not only quantifies the force exerted through the feet, but also identifies its origin and any potential instability. So this feature proves when assessing patients' objective outcome measures, such as their sit-to-stand or their tug scores. Another noteworthy technological advancement from VAL is the human track. So this tool evaluates a patient's performance in various movements, including squats, stability exercises, single leg stand, tandem stands, and standing posture. It thoroughly analyzes the body, scrutinizing joint angles, detecting asymmetries, and providing insights into overall movement patterns and joint dynamics. By leveraging these tools with the SFMA, we create a comprehensive approach that allows us to make informed assessments and take corrective action as needed. So when should we introduce technology? In my view, technology should be integrated from day one, regardless of the patient's age or demographic. Its significance lies in providing a visual representation, precise measurements, and enhanced patient engagement. Personally, I find value in observing results on the screen, as it goes beyond verbal explanations from a healthcare provider. So this approach not only enhances the treatment experience, but also fosters patient involvement and allows them to track their progress over time. It provides a clear visual roadmap for identifying issues and guiding corrective actions, showcasing the positive changes that occur throughout their journey. So now let's introduce the star of the show, Jane Doe. So Jane Doe is a 55-year-old patient who suffers from low back pain. She is a retired kindergarten teacher. Her pain started about a month ago. It's greater in her right lumbar region than the left, and she says her symptoms are constant. Her past medical history and precautions show no known allergies. Medications include lisinopril and Motrin. Past medical history shows anxiety, depression, osteoporosis, hypertension, COPD, and an MRI recently shows disc degeneration in the lumbar region. Functional limitations: before this onset started, she was able to perform all ADLs with no restraint or pain. However, now she's not able to dress herself without assistance. She can't cook, she can't clean, she can't go shopping, and most importantly, she can't visit her daughter who lives on the 3rd floor of her apartment complex. The verbal analog scale shows her coming into the clinic with 7 out of 10 pain. At best, it is 5 out of 10, and at worst, it's 8 out of 10. Her location is in the right lumbar region, greater than the left. It's exacerbated by walking, grocery shopping, and going upstairs, and it's relieved by lying and not moving. So our patient's goal is to be able to go shopping with her children without her lower back hurting too much. To achieve this, we plan to have sessions with her 1 to 2 times a week for 12 weeks. At the start, we'll see her twice a week until her pain is mostly a 2 out of 10. After that, we'll switch to just once a week through telehealth, except for her last week. So in the final week, we want to make sure she's getting better, summarize her progress, and we need to perform some final measurements and ensure she is safe for discharge. So starting with phase 1, our primary focus is on protection. During this initial phase, our goal is to educate the patient and alleviate her fear of movement. We will begin by gathering a comprehensive medical history and obtaining measurable data. Additionally, we may recommend the use of technology such as the Aura Ring. The emphasis here is on education and building rapport with our patient, as this is the most important piece of treating a patient who's coming into our clinic with pain, especially as Jane Doe is coming in with 7 out of 10 pain. She's most likely going to be fearful of movement and avoid going into any positions that she feels could compromise her diagnosis. So we really want to just protect her and build that rapport. Moving on to phase 2, we transition into corrective interventions. By employing the SFMA, we can identify any existing bodily imbalances or asymmetries. This assessment serves as a foundation for devising a tailored treatment plan. We will incorporate various interventions and exercises to strengthen identified weaknesses, and moreover, we can deconstruct the SFMA into specific components to address individual issues. So for example, if the patient is struggling to do a single leg stance, we will then assess her core stability. If she's still not able to do that, we can break it down further by examining her in a half kneeling position. If there's still weakness and inability to do that, we can look at quadruped position. And this goes all the way down into rolling patterns. So if a rolling pattern is the only feasible option to see how our patient's moving, that's where we're going to begin and then work our way back up as needed. Especially in low back pain, rolling patterns are very common to analyze. So by deconstructing these patterns, we can implement targeted interventions and gradually advance from one stage to another. Lastly, phase 3 revolves around development, encompassing rehabilitation and maintenance. Here, our primary objectives are to minimize asymmetries, ensure graceful and intentional movement, and promote body awareness. So this phase represents the combination of our treatment journey, where we establish comprehensive systems to support the patient's ongoing progress and well-being. So let's wrap up this discussion by highlighting the unique approach to treating low back pain. This method revolves around 3 key principles. First, we emphasize the importance of regular mindful movement underpinned by a holistic assessment. We don't limit our evaluation to the back alone. Instead, we consider the entire individual, taking various contributing factors into account facilitated by the SFMA. Second, our strategy revolves around protection, correction, and development. We provide precisely targeted interventions uniquely developed to an individual's specific requirements. So no one-size-fits-all solution here. It's all about personalized intervention plans. And then third, we establish systematic frameworks for these principles. So seamlessly integrating state-of-the-art technology into our approach, this empowers us to conduct precise analysis and actively engage our patients in their treatment journey. So the benefits of our approach are clear. We achieve improved outcomes because we address the root causes. Our patients receive individualized care that meets their unique needs. And importantly, we're dedicated to reducing reports of low back pain disability. So incorporating this innovative approach into our practice helps us deliver more effective, personalized, and patient-centered treatments for low back pain. And that's it. Thank you. If you have any questions, feel free to let me know. Special thank you to Dr. Dennis and Dr. Danielle for meeting with me and helping me learn more about these topics. And then here are some slides going further into topics that were discussed during this presentation.